Today is Tuesday, July 15th. This is Wake Up with KERA News, and I'm Andrew Garcia. We can expect partly cloudy skies this morning and later today. There's a potential for the return of rain and thunderstorms through this evening. A UT Arlington physician and faculty expert says a new law meant to address a growing doctor shortage in Texas doesn't address a key issue. More about the pros and cons of the Doctor Act. That's after the news. Environmental advocates in two Dallas neighborhoods say they want to shut down a pair of industry sites they've dubbed the Toxic Twins. For years, residents in West Dallas and Joppy have said the asphalt shingles factories in their neighborhoods are causing environmental harm. Janie Cisneros leads the advocacy group Shingleton United/Unidos. She says the new residents and children are being diagnosed with conditions known to be linked to industrial pollution. The group is partnering with downwinders at risk to call on the city to shut down both factories through a process known as amortization. The city earlier this year removed residents' abilities to start the process themselves. Phil McGraw, better known as Dr. Phil, is launching a new media network. The news comes 2 weeks after his previous venture, Merritt Street Media, voluntarily filed for bankruptcy and sued its partner, Trinity Broadcasting Network. The new company is called Envoy Media Company. It will host original entertainment programs and will also implement videos recorded by citizen journalists in its broadcasts. The network will operate out of the Dallas area, according to The Hollywood Reporter, but it is unclear if it will be in Merritt Street's former Fort Worth studios. Texas lawmakers this year passed House Bill 2038 to help offset a projected shortage of more than 10,000 doctors by 2030. The Doctor Act allows experienced international medical graduates to skip residency programs required in the U.S. Dr. Ogon Gurel, a physician and faculty expert in the Healthcare Administration program of UT Arlington's Business College, believes the Doctor Act doesn't address the real cause of the doctor shortage, a lack of residency positions.
I believe Texas is last in the nation in the ratio of residency spots to medical school graduates. In other words, there are less residency spots in Texas than medical school graduates. Most doctors practice where they do residency. And so, in effect, Texas is exporting its medical students to other states. So I think the core bottleneck is the lack of residency positions. And of course, that fits with the Doctor Act because there's a lack of residency positions even for American medical graduates in Texas. Therefore, requiring the foreign medical graduates to take that residency is effectively even making that problem worse. So having them jump over residency is a solution.
Do you look at this as a sustainable approach to trying to resolve the shortage of physicians?
Increasing the number of residency positions is going to be the sustainable solution. But residency costs a lot of money. It's about $1 million.
Wow.
And that comes essentially through Medicare and Medicaid. Texas is aware of its particular shortfall in residency positions, and there are some state initiatives to supplement the financing of residency positions, but that hasn't really ramped up. And I would encourage the legislature to really accelerate that state financing of residency positions.
How in the world do you make that happen?
Well, like anything, more money. Allocate more funds to residency education. The technical term is graduate medical education by the state of Texas.
If we don't address this by the target date for reaching this major shortage, what happens?
So in public health, we have what's called the iron triangle, the three pillars that a public health system tries to optimize to ensure health of the population: quality, cost, and access. So we want to maximize the quality, minimize the cost, and maximize the access. The most important is access. Reduced access to healthcare has significant consequences. because obviously people don't get taken care of and they will die. And ironically, the cost to the system also increase because care that's deferred typically then progresses to more intensive care, and that is going to be more costly, or primary care that's not seen ends up in the emergency room, which is also more expensive. So I think that not addressing the issue is going to have pretty significant bad consequences. But there are other measures we can take, and one of them is increasing medical literacy among the population, knowing how to talk with the doctor and knowing how diagnosis works and knowing how the medical system works, the basic principles of how to get better if you are sick. And I think some degree of medical literacy can increase the efficiency of people's interaction with the healthcare system, can help this situation. It's not going to turn people into doctors. That's not what I'm advocating, of course. But to be a partner with your doctor, to understand how the process works. And I think that can actually ameliorate to some extent the physician burnout, because working with patients who really lack that medical literacy can be really exhausting and challenging and frustrating when they don't follow the instructions and the outcomes are not good and so forth. So I think I would add bringing some programs around medical literacy can be quite helpful as well.
That was KERA Sam Bekah talking with Dr. Ogon Gorel with UT Arlington. The Texas Rangers had the 12th pick during the MLB draft on Sunday. The team chose Gavin Feen from Glen Oaks High School in Temecula, California. The Rangers haven't selected a high school player in the first round of the draft since 2018. Get your ticket for Cosmic Bloom, an evening of tarot and guided journaling for those seeking to reflect and explore their creativity. Tickets include light bites and a signature drink. For more information and other fun things to do, visit our Go See DFW calendar at kera.org/calendar. Thanks for listening to Wake Up with KERA News. I'm your host, Andrew Garcia. The show is produced and edited by Shardae White and Bekah Morr. For more news in your inbox, visit kera.org/wakeup. That's where you can subscribe to the Wake Up with KERA News newsletter. You'll get a more in-depth look into the news with plenty of good morning vibes. Connect with us on Facebook, Instagram, and TikTok at KERATX. Take care, and we'll see you tomorrow.